For many women, things like painful periods or heavy bleeding have been dismissed as something they simply have to live with. And in her new book, A Terrible Strength, The Hidden Crisis of the Black Womb and Your Survival Guide to Healing, author and UW professor Dr. Kemi Doll explains why that mindset is particularly harmful for Black women and what all women need to know to better advocate for their health. Dr. Doll joins me now to share more. Thank you for being here.
Yes.
Congratulations on your first book, such an important topic. You say women's pain is being normalized when it shouldn't be. So why do you think so many women are just told to accept it?
You know, I think a lot of us learn, the first thing we learn when we first get our periods is how to keep it a secret. You know, we learn how to be very discreet, and we don't necessarily learn what's normal amount of pain. What should we expect? So you might be going along and thinking this is just what a period feels like, when in reality your pain is completely out of what we would call normal as physicians, and there's treatment available. But I think that's really where it starts. We learn how to keep it a secret.
Absolutely. And why did you think right now of all times was important to tell this and write this book?
Because I feel like we are in this renaissance moment where we are talking about more women's health beyond just pregnancy, right? And I love that, and it's really important. And I want people to know that their womb health lasts a lifetime. And a lot of us deal with these conditions every day when we're not pregnant, most of the time. And yet there's not a lot of help out there. There's not a lot of treatment that people are accessing because of this normalization.
Absolutely. We always just think, oh yeah, this is part of it, just deal with it.
Yes.
You argue the strong Black woman stereotype can be harmful as well. Why?
It can be because, you know, Black women, we are strong and we have to navigate a lot of different oppression in our society, and I get that. The problem is, though, when you're so strong that you can't be vulnerable and other people can't see that you need care. So when Black women have 80% rate of fibroids, when we have more likely to have endometriosis, when we have more likely to have uterine cancer and die from uterine cancer, we have got to shift that narrative so people can see that Black women are also vulnerable and we need help when it comes to our womb.
Wow, beautifully said. And many women grew up watching women in their life suffer in silence.
Yes.
How has that generational experience shaped the way women think about their own health today, would you say?
Thank you for asking. So many of these conditions actually run in families: fibroids, endometriosis, etc. So if you saw your mom bleeding a lot, having a lot of pain, your aunts, your sisters, you just think that that's the way it is. So your family normalizes things for you. That's very normal for all of us. That's why we really need to access good gynecologic care, because we can reset that and say, actually, this is something that's not normal. We can help you out and help out all members of your family. So I think we learn these kind of things because of our family units.
Definitely. And some of these things are even hard to diagnose, right?
Yes.
Like we're talking about endometriosis, and I think just going in then and having this conversation is important, would you say?
Critical. So many of the things in gynecology are based on how you feel, which means you've got to let us know, hey, I'm bleeding too much, or my pain is out of control. That starts the diagnostic process. It's why I wrote the book, so women can feel empowered to know, hey, what I'm going through is not normal. I'm going to go to the doctor and get it checked out.
Definitely. Is that the takeaway that you want from the book then, for people to read this, women especially, and feel that empowerment?
Absolutely. I mean, it's very informative, it's engaging, but at the end of it, I want you to feel like I know so much more about my body, and so now I'm clear about when I can go and get help, what kind of help I can get, and I get a better quality of life out of it.
Definitely. And what, in your opinion, needs to change in the way patients are treated for these symptoms?
Oh, this is a long answer, but here's a short version, which is that as physicians, you know, we have got to stop expecting women only to come in when they're extremely severe, when they can't handle anything else at like the last moments, and then offer them only surgery, for example. A lot of us, we don't want that life. We want to be caught when things are mild. We want to be paid attention to when, hey, it's not terrible, but it's not great. And so I think as physicians, we need to shift our perspective to say, we're not just going to take care of you when things are severe. We're going to start when things are just slightly off so we can prevent the severity in the future. And that requires listening and being very, attentive to subtle cues and really being curious about your patients.
Definitely. It's so important to have that one-on-one time and not feel like you're being rushed out, that you're really feeling heard there and not dismissed.
Exactly.
I guess that's how a lot of women with this topic feel sometimes. What do you want women to know about taking earlier action when it comes to their health?
Oh, we have so many things to offer. That's what I want them to know is like, I love gynecology because there are a lot of treatments. And also in the book, I talk about vitamins. I talk about lifestyle changes. Like there's a lot of things that we can have access to if we just know about them. And I don't know about you, but I just always want to know so I can take some control and optimize my health. And so I want women to know that that is possible when it comes to womb health too.
Knowledge is power. Do you have any tips then, or like vitamins you could give me a little teaser?
Okay.
Or do I need to read the book?
Okay, here's a little teaser.
A little tease.
Vitamin D and fibroids, so good. Vitamin D has a stabilizing effect on fibroid growth. A lot of people don't know this. So that is just like such an easy supplement to take. If you have fibroids or you're concerned about them, it's like a no-lose situation. So there's one tip, and there's so many more in the book.
Okay, well, I think that's a good place to end. Where can people get your book quickly?
Anywhere you can buy books, you can find my book. Amazon, your library, your local independent bookstore, please support them. You can find my book also on Kindle.
Amazing. Thank you so much for being here. That was really insightful and amazing.